This MVI training program is a complete 9-part course on the GMP of logistics. To gain maximum benefit, we suggest that the parts should be shown separately, and at the end of each there should be a discussion on the relevance of the information and its implications to your specific activities. The MVI training qualification test should be completed at the end of the course. Some people call them drugs, to others they're medicines, but whatever you call them, they're the pharmaceutical products, the pills, creams, injections, and thousands of other medications and healthcare products that are designed to prevent sickness or disease, or assist with their diagnosis, their treatment when they do occur, and then, of course, to alleviate the pain and suffering they bring with them. Now, the manufacture of such products is closely controlled by government-appointed regulatory authorities such as the FDA, the U.S. Food and Drug Administration, the MCA, Medicines Control Agency in the United Kingdom, and similar bodies in virtually every country where healthcare products are manufactured. They all follow the principles or rules that sometimes are called current good manufacturing practice, or, as we'll use throughout this program, the shorter GMP, which stands for Good Manufacturing Practice. There are, in fact, just 10 basic GMP rules, so let's run through them, starting with the fundamental principle that every action will be undertaken only by following current written instructions. That raw materials must be stored and handled correctly, and that exactly the right materials must be used at all times. That all facilities and machinery are correct for the purpose, and that they and the environment in which they are situated is properly cleaned and appropriately treated. That quality control is undertaken at every stage of the storage, handling, production and packing cycle. That both production operators and support staff must dress and behave as required, be properly supervised, and, above all, be trained correctly. That all work must be undertaken precisely and accurately. That contamination of materials by either physical or viable, that's microbiological sources, must be prevented at all times. That only the specified materials are mixed. That everything is labelled at each step, and finally, at every stage, that accurate and clear records are kept of everything, of every process, and then checked to be sure that it has been done. The GMP definition of quality is that the product must reach the consumer, perhaps we should say the patient, fit for its intended purpose. And GMP rules are designed to control the quality of the manufacturing process so that the product is precisely to specification every time. But let's just examine this idea of product quality in a little detail, because it's not all that many years ago that manufacturers first made the product and then, when it was finished, maybe tested it for quality. The variable, sometimes poor quality of drugs that could result from this approach meant that medication often caused fever or a deterioration of the patient's condition, and even subsequent death. Unfortunately, then and now, it's not practical to test most medications after production, because in order to test them, you have either to destroy them or render them unusable. By the second half of the 20th century, heightened social responsibility brought with it widespread government regulation over most aspects of our lives, with the regulation of drug manufacture, thankfully, a welcome development. Expectations now are much higher, and we assume that everything we buy will perform exactly to specification, a condition brought about by the adoption of quality assurance, which means simply that at every stage the product is manufactured to a series of pre-planned operations or processes which, individually and together, have already been proved to work, or, in GMP terms, have been validated. GMP is just that, a quality management system comprising pre-planned, start-to-finish standard operating procedures called SOPs that, when followed exactly, assure us that each product, in every batch, will be precisely fit for its purpose. Actually, the same or very similar rules apply to a much wider range of products than those we mentioned earlier, and includes all the medicinal products that are prescribed by doctors, as well as those we buy over the counter in the pharmacy or supermarket. They include all those things we take by mouth, those that are applied to body openings, such as our eyes and ears, and of course to wounds. Similar quality rules apply, for example, to medical devices, the gases used for anesthetics during surgery, and, quite rightly, even to many toiletries and cosmetics. They all have a common quality that, when they reach the customer, they must be fit for their purpose. So, what does this fit for its purpose really mean? Well, if you were in need of medication, you would expect it to be precisely as prescribed for the medical condition you were suffering, whether that be coping with a headache, maybe controlling diabetes, or even a life-threatening disease. You would expect it to have been made properly, to the right, that is, the necessary strength. In addition, for your safety, it should be free of any contamination, which means contain nothing but the specified ingredients, must not have gone bad or deteriorated in any way, be in the correct container, correctly labeled, and, obviously, the container should be properly sealed and protected from mechanical damage during its travels from factory to patient. At this point, we can almost hear you say, but all that is a problem for manufacturing. I work in the warehouse. Okay, that was to give you the background. Now let's move on so that by the end of this program, you'll understand why and how GMP is an essential part of your job in logistics. Traditionally, logistics was the term used by the military to embrace the procurement, maintenance, and transport of materiel. Now it's used as a one-word description of similar commercial activities, which separately we call storage, materials handling, and distribution, all three of which are subject to GMP regulatory control. We work in different places and countries, and often call the same things by different names, so let's examine each of these in a little detail. To store something is to hold it safely for future use, and in the world of GMP, this applies to both the manufacturers and specialist packaging companies, where the products are usually segregated into separate sections and ideally occupy different physical facilities. They handle inventory of different types. For manufacturing, this will be the starting materials such as bulk powders, granules, and liquids that form the ingredients, or alternatively, if the operation is just packaging, the bulk finished product. Whichever is the case, they will also receive the appropriate packaging and labeling materials and store the lot until needed to complete the entire production and packaging process. On completion of the manufacturing process, the next stage is to receive these goods from the production department and to hold them safely in stock until shipping instructions are received. Some manufacturers hold their own inventory of finished products and sell directly to those who deal with the patient, such as hospitals, retail pharmacies who dispense prescription drugs, and they and other retailers who sell healthcare products over the counter. There's a growing trend for manufacturers' inventory to be held by specialist intermediate logistics contractors, companies still under the GMP regulatory eye that receive finished products, hold them safely in store, and ship them when instructed by the manufacturer's sales department. Most manufacturers distribute some or all their products through wholesale distributors or dealers who buy the inventory for storage in their own warehouse and then undertake sales to the hospitals and retailers. Products distributed by them are subject to identical physical controls, the only difference being that they own the product while it's on their premises. A common factor between the stores of logistics contractors and wholesalers is that they will hold products from several companies, while the manufacturer's warehouse will almost certainly only hold its own product. Regardless of their function, the stores or warehouses of manufacturers, logistic contractors and distributors have a single purpose, namely to receive goods and materials from outside, to hold those goods and materials in storage safely, and to ship them out and transport them without damage on the next stage of their journey. We saw earlier that GMP codes control the manufacture of every medicinal product so that it's the right strength, is free of contamination, must not have gone bad or deteriorated, is in the correct container, is correctly labeled, and that the container is sealed and protected against damage. Obviously, many of these requirements are beyond the direct influence of many logistics operations, but equally many are not. And GMP guides are clear on the facilities that should be employed. To start with, the premises in which materials and finished goods are stored should be located in an area where the risk of contamination from adverse local environmental conditions is low. The buildings should be of sound construction, maintained in a state of good repair, provide protection against the weather and the entry of insects and other critters such as vermin and birds. Weather protection is essential at receiving and unloading, as well as loading and shipping bays. In addition, storage areas should always be in a secure state, with entry permitted only to authorized personnel. The environmental conditions within the warehouse must be appropriate for the materials and goods in store. For example, heating, lighting, ventilation, and humidity should not affect the quality of these materials, while, of course, being comfortable for staff to work in. The rules say that warehouses should be big enough to allow for the storage of the different types of materials to be housed, which, for a manufacturer, includes the starting materials or raw materials, packaging, usually of many types, bulk products waiting finishing, and ready-for-use finished products. In addition, the storage of many of these items must accommodate their different operational status, such as approved, in quarantine, where materials may be subject to further quality control and then either released or rejected, returned, or, hopefully rarely, recalled, both of which we will look at in detail later on. All GMP rules are important, and rarely is one more so than another, but in terms of logistics, selecting the right material is high on the list of critical factors, using a method called first in, first out, usually abbreviated to FIFO. FIFO ensures that stock rotates and that the materials and products that have been in stock for longest go first. FIFO applies to all three categories of stores or warehouses because, more often than not, both the raw materials used in the production of drugs and the drugs themselves have specific shelf lives, after which they can deteriorate and lose their effectiveness. GMP is one of several quality management systems. Another is the ISO 9000 International Quality Standard, or the FDA's Quality System Regulations for medical devices, and all of them require a quarantine area in stores. This is space allocated to the storage of usually incoming materials, waiting verification or testing. This quarantine area should be clearly marked, secure, and accessible only to specifically authorized personnel. A few moments ago we mentioned that the temperature and humidity of all warehouse environments must be appropriate to the products held in them. And, of course, some products must be kept at very low temperatures in special cold stores, which are basically large refrigerators, while others, such as powdered, freeze-dried drugs that will be reconstituted with water prior to use, require extremely low humidity. Such environmental conditions cannot just be installed and left to their own devices, and must be monitored regularly and maintained to specified tolerances. In fact, all environmental systems should be validated, which means that they must be proven to meet their operating specifications and documented accordingly. This applies equally to the general environment and refrigerated or freezer units. The instrumentation installed to monitor these conditions must be calibrated and, of course, documented. In addition, some materials are toxic and dangerous, apart from which there are drugs that require special controls, both of which need to be located in areas of high security. By now, you'll understand that handling and storing GMP-controlled healthcare products requires more critical attention to detail than is needed for many less demanding inventories. And if you work in this area, although some of the requirements are things that you personally can do little about, it's important that you understand the reasons behind all the regulations. For example, the need for stores and warehouses to be kept as clean and tidy as possible is an extension of the care that goes into making the products in the first place, as is the need for the environment to be kept in good repair, a principle which extends to every person working in them, in particular reckless handling of forklift trucks and careless maneuvering with carts can both cause damage to the building and facilities in it and damage the goods being carried. Incidentally, one of the requirements, and therefore a characteristic of people working in GMP-controlled environments, is that they take a personal interest in what they're doing and, rather than turn away and saying, "That's not my business," undertake to report any discrepancies which, in the context of logistics, means reporting damage to the building, inventory, or anything else that is wrong. We probably go on a bit about security in GMP stores, but think about it. It really is a critical matter. Imagine that there's been a break-in, in which case, and obviously, any loss of inventory is bad news for the company, but equally important, consider the danger if what remains has been contaminated, maliciously damaged, or rearranged. Remember, these storage areas are to be worked in only by people who have undergone GMP training, as you have, and that applies to everyone who visits. They should never be left on their own. We mentioned earlier how important it is to protect buildings against the entry of wildlife, but we'll raise it again here. Protect against the weather, because rain, snow and dust will all affect adversely the products in your care, and because they are also a matter of security, which means that entrances should be kept shut at all times when not in use, to stop the entry of critters of every type. It's very difficult to overstate the importance of fitness for purpose, quality as defined for GMP-regulated products, a standard that requires a very high level of precision during manufacture, which is why any visitor to such a plant will notice immediately that virtually everyone in sight appears always to be either writing or, alternatively, nowadays, entering information on a keyboard. This focus on documentation of every activity as it happens really points to how effective GMP is. The reasons for documentation are understandable because, firstly, as instructions, they enable us to be quite clear as to what we must do, and then, as records, to confirm that we've done the right thing, and so enable the investigation of subsequent complaints and/or defects to identify precisely, for example, which actual containers are in query, to determine the appropriate actions that will eliminate that problem in future. The manufacture of many products must be licensed by the regulatory authority, a condition of which is that they must carry out regular inspections, which rely heavily on an analysis of historical data to assess conformity. In addition, the company must itself undertake regular internal inspections or audits to monitor performance, and the availability of detailed records is essential. No less important, the history of what we have done to underpin what we do now gives a multi-layered direction to what we need to do in future, and justifies the apparent preoccupation with documentation. There are two types. First, the instructions, which detail what's to be done and how to do it. These are generally called Standard Operating Procedures and referred to as SOPs for short. A few examples of the activities written up as SOPs include the receipt of materials into warehouse, or of packaged products, how to pick and assemble an order, the procedures associated with dispensing, all about protective and safety apparel, or cleaning, procedures for ensuring FIFO, the first in, first out